The Connection podcast, hosted by Yuma County Anti-Drug Coalition and Yuma County Mental Health Coalition, is a community-focused podcast dedicated to informing, educating, and empowering listeners on drug prevention, mental health awareness, and strengthening partnerships for a healthier future.
Welcome to the Connection podcast, brought to you by R.L. Jones Insurance. I'm Joanne Pfizer, Executive Director of the Yuma County Anti-Drug Coalition, and with the Yuma County Mental Health Coalition. We are here today on the Connection podcast. Our guest is John Abarca. Welcome.
Thank you for having me here. I'm John Abarca. I'm the Regional Vice President for Community Bridges.
That's awesome. I'm so glad you're here. We have so much to talk about.
Always.
We always do. Well, definitely share with everyone what your agency brings to Yuma County.
Okay, in Yuma County, we provide a broad spectrum of services. We have an outpatient clinic that incorporates opiate treatment programs, so that's methadone, Suboxone, treating opiate use disorders. We have a residential program, it's a 24-bed co-ed facility.
Wow.
More likely people know them as rehab kind of facilities, so it's that level of care. And then we also have the crisis unit and the inpatient psychiatric unit that does the involuntary psychiatric holds.
That's awesome. That's a big job, all of that, all
Absolutely,
together. Your
yes.
campus is big, and it's a nice area. I've been out there.
We've been in Yuma since, 2010-ish, and it just keeps growing. The need keeps growing, so we keep growing with it.
Well, you guys help a lot of people.
Yeah, I think that we started as an organization back in 1982. We've been in Arizona since then, and we're around the state now. We've kind of grown pretty much every metro area in the state. We have facilities.
Oh, wow.
We're probably one of the biggest rural providers of substance use and mental health services in the state. And then about 2-3 years ago, we were approached because they saw what we were doing, and they came to us and said, hey, can you do this in other places?
Oh.
And so we are now in Oklahoma, in Idaho, Washington, D.C., we have quite a large operation in Washington, D.C.
That's awesome.
And growing. We'll be announcing a facility in Maryland.
That is
I'll be
great.
setting up.
And so you're traveling a lot more now.
Traveling a lot more.
Yes, but for good reason.
Yeah, no, I think the need,
Love
especially
it.
for mental health and substance use, has just, it's always been there, but I think it has gotten more attention now, and we're doing more about it. We have a lot of evidence-based approaches and interventions that we can offer, and now that the stigma behind it is kind of going away, and people are realizing that you don't have to live with this. We can address it, you can get better, there's a life after this, and they're open to it, so we're bringing that now across the country.
That is so wonderful. I love that word stigma. I love breaking it. You know?
I think that's been one of the biggest barriers for people to engage in treatment, because if someone reaches out for help, they think like, well, what is everyone going to think about me? And how does the community look at me? And you start to realize that, substance use disorders and mental health is not just focused on any one segment of the population. It just transcends every aspect of the population, the community, and if you don't get the treatment, it doesn't get better on its own. It's not one of those things that you can just say, well, I just hope that tomorrow it'll be different. It doesn't get better on its own. It needs those interventions, and it can be better. And, our organization, we have about 2,000 employees, and of that group, over half of them are in recovery.
Oh, wow.
Which is what really
That's
brings
awesome.
a dynamic to our organization that is very personal to our staff. It's not just a job. It's not just something I went to school for. It's something that a lot of people in our organization have lived through.
Wow.
And so now, they approach it with this, like, I can tell you, I can show you, I am the example of what life can be like beyond that.
That's amazing. I love that. Like, just leading by example.
Absolutely.
Leading by example and bringing those people along with you, making their lives and themselves better. That's just so important.
Yeah, and I think that also really looking at what has changed. We've been doing it again since 1982,
That's
and even
awesome.
since then, so much has changed in this field. It was very in the past, substance use specifically was very the treatment for was very episodic. It was like, oh, we're going to hit you with this and then kind of walk away. And now you start to realize that you have to approach people in a holistic manner. You have to really address all of their needs. And that has changed the way that we approach it too. We offer everything from primary care to psychiatric to addiction medicine to counseling to therapy to all those things, because you have to be able to meet all of those needs for the individual if you really want to make a difference. If you really want to kind of have that person grow beyond where they're at, you have to meet all of those needs, all those, we call them social determinants of health, housing, employment, education, all those things have to be addressed in order for people to get better. And so you build a model that does that. And, I think that I always laugh with people because I always tell them, ask me, I'm the biggest critic of the system, right? Of everything that's available. And I can tell you everywhere that there's gaps and what we need to do better here in the state, right?
Yeah.
But you go outside of Arizona and you start to realize that we have a really good system.
Oh, I bet.
Are there things that can be better? Absolutely. And we're working on those every day. But that's really what's, caught the attention of some people nationally. And they're coming to Arizona and saying, hey, can you guys bring that and do it here?
And Yuma is big.
Absolutely.
Yuma is a big example for the state. And I see that.
Yeah, everywhere
like what
we
you're
go,
saying.
I tell people, I'm like, you guys aren't doing this because this is what we do at home. This is what we, and I think you're right. I think Yuma has this unique community mindset. The competitiveness and the us against them kind of thing doesn't really exist. And so when you go to other communities or even other states now and you tell them, no, we can do that, and they're like, it's so foreign to them that coming together and collaborating and it's not about just because you're my competitor or something. It's no, I'll come help you along and do that. I'll come alongside you. And so it's a different approach. And I think that really comes from Yuma. I think Yuma has that effect on people. And it really is a big benefit when you're taking that to other places.
It is. And I think of Yuma as being a great example. We have a lot of different agencies that have been modeled outside, of just our community. Has graduated into other cities in Arizona. But just looking at CBI and knowing that, your base more or less here is a big campus, correct?
Yes.
So you have a big campus here, and now you're going across the country. I think that is prime example of Yuma and all of the impact that you're doing for us.
Absolutely. I think, when I started with CBI, honestly, I didn't know what I was getting into. I came from, I did fire for a long time, and I was just coming into this and I think, as a matter of fact, some of the staff that were there before me had a pool to see how long I was going to last, because people don't last in this field. It was just such a real, and I came in and it was just like, I love this. I get up every day just like, how do I do more? How do we get more people? How do we impact more lives every day? And so that's just really what's been driving my stay here. But then taking that, really being able to take that across the country and take it across to other communities and really show them what's possible. I think this organization is a huge example of what's possible, because you don't see that. You don't see, 40, 50 people showing up for a meeting to get together and to collaborate and to see what's everybody doing and how can we work together. You don't see that in many places. And even in those communities where we have meetings, and because I have to go to all these things across the state now, and it's very unique. It's not organic.
Oh,
it's not when you do get people to come together. It's not organic. It's not in the same. And I'm just like, it can be better, you guys. It can be really. And so how do we kind of show them that and take people to that place?
Right. And I see our group as a group, not as silos.
Absolutely.
That are in their own lane and doing their own thing. When people come to our meetings, our coalition meetings are a group effort. We always mention that it takes a village to make an impact and do what we do. And everyone, and even after our meetings, they're like talking to you. They're like wanting to, collaborate. And it's just... I
think there's been a number of collaborations that we've had that have been birthed in those meetings. Someone will bring up something and, hey, you know what, let me talk afterwards. And then all of a sudden we're doing something that came from just sitting together at a table.
Yep.
And I think that that's really where things start. again, we to boast about us, I always say that most of our programs in Arizona, we have about 40 to 50 different programs that we run, and almost every program has come about like that. Someone just said, hey, there's a need, what can we come up with? And so it's again, our organization a little bit different. It's not top down. It's really all of our programs are birthed at the ground level. Someone that's actually sees a need and says, this isn't being met. How can we meet it? What could we do? And then we start to come together, and all of a sudden it becomes a program.
That's
and all
amazing.
of a sudden we're doing something different.
Yeah.
But yeah, I think that idea of collaboration is rare. And I think Yuma is very unique, and to be able to take that is pretty awesome.
That's great. And you've been part of the coalition for a long time. The coalition has a lot of resources around the table, and like you're mentioning, a lot of people come together. We do meet the second Tuesday of every month, and your agency has been a pillar in our coalition and our champions that that do things for the community. We've seen you be a panel for us at our forums at City Hall and for the different things. What other things do you guys do to get that outreach for CBI in here?
So there's several things that we do. One of the areas that we really focus on is for lack of a word, is researching kind of what's happening in each community.
Oh, that's awesome.
What's taking place. I think a few years ago we were highlighted in a documentary on stimulants. Yuma, the Yuma community was, and we were talking about that, and there were some people in the industry who were saying, stimulants, we're in the middle of an opiate epidemic, what are you talking about stimulants? Well, we got to be looking in the future. What's the next cycle? What's the next thing that's going to affect us? And then how do we prepare for that? What are the resources? How does your system need to look like in order to be able to meet that? And so I was reading, again, you're part of the research you're looking at, you're talking to different entities that are involved. 700 kilos of cocaine were caught in San Luis on Monday.
Wow.
700 kilos. That's $15 million street value of cocaine. And that's the stuff that gets interdicted. That's the stuff that gets caught. What's getting into our communities? Stimulants are coming back. So what does that mean for that? We have to now prepare for how do you address stimulants? Well, with opiates, it was medication-assisted treatment and gearing up for that, developing treatment and medications and all that could do that. Well, now for stimulants, what are we seeing? We're seeing a lot more neurological damage. We're seeing psychosis. So how do we gear up for that? Well, we're going to be seeing a lot more inpatient stays. We're going to be seeing a lot more neurological issues with individuals. So being able to start right now developing those interventions and then those treatment modalities to be able to address that in the next 5 to 10 years, because that's the next cycle that comes up in that process. It also will affect mental health, right?
Yep.
So the two together, we don't really look at, in the past, kind of going back to the silos thing, in the past, substance use and mental health were really treated as
separate.
Yeah, they were two separate issues. They're intertwined. And you have to be able to address both of them rather than just one thing or the other. And so being able to develop systems that address that, and then being able to advocate for, at the legislature and at the payer levels to say, hey, these are the resources that need to be in place in order to meet those needs that are coming up. So that's kind of the stuff that we're doing, is really being able to be that voice to say, here's what we're seeing. We're a big enough system that we can kind of tell you what's happening, what's coming through our doors, and what are we starting to see. We started to see cocaine a few months ago, actually within the last year, and and people kind of thought, what are you guys talking about?
Yeah, that's gone.
And here we go. We got 700 kilos in one day that get caught because it's making a comeback, and so being able to gear up for that. So that's kind of our approach, and again, being able to have that information to drive the process. What's happening next? What do we need to prepare for? And not just deal with what's happening in front of us today, but what happens next month? What happens next year, in the next 5 years? And then being ready for that.
Yeah, there's trends for everything. And it's scary, but there are. And doing that research and getting that information out and doing prevention work,
Absolutely.
Prevention work is huge.
We can respond to the need, right? But it's so much better to get ahead of it and address that. With a couple of years ago, we did a conference. I did a presentation at a conference on we call the loneliest generation, and really talking about Gen Z and how they're being affected by this disconnection, you know, and how attachment theory plays into that, and how they're more vulnerable to substance use. We're treating that generation for anxiety and depression like never before.
Wow.
We're medicating them for that, but what's the likelihood that that's also driving substance use? What's the likelihood it's driving suicide rates? All those things are playing into that. And so again, being able to do that research and being able to have the data in hand to drive the decision makers to really focus on those needs and address the needs.
That's so important. All of that stuff is good stuff, and it really helps our community. I think, and I've said it multiple times, you know, knowledge is power, and we share that around our table. You know, we've had you present before. We have so many good presenters, you know, in our coalition, and people go away with stuff. Like, people really, they're inviting people to learn about these things.
Yeah, they and I get phone calls after the meetings like, hey, can you come talk to our group, or can you come and do this? I think, you know, I did one for the military after one of the meetings.
Yes.
They invited, and they're like, hey, and so I'm thinking I'm going to come in and just do a couple of the Marine guys here. No, there was like 800 people in this presentation.
Yeah, Jenny and I
that was
went out
nationwide.
there too.
And I was like, what happened? Wait, I thought this was, but again, Virgil's in our meeting is the one that invited, and it just kind of, you know, snowballs from that. And there's a bigger impact, right? There's that impact that we really need to have to make a change. And so, I think that's one of the biggest benefits of that meeting and that organization.
And our coalition
is that we really, you know, it really is a coalition. It's everyone coming together to like, hey, where can I come alongside you and help you accomplish those
Well, you know, I have you on speed dial because, you know, and one thing that I love is that you do answer back, and it's not, and I don't feel like I'm an emergency by any means, but you are just so knowledgeable and help in so many different ways. I just know that if I need something right away or an answer, I reach out to John, and I thank you for that. Thank you so much. Again,
coming from a fire background, my world is 24/7. I've always, you know, lived that. So, it doesn't bother me to answer phones. I just recently was in Payson and handed out my business cards to all their police officers have my phone number now, because sometimes they just have this question.
Just this question.
How do I deal with this?
You know, it's like, this question.
And again, so my role now is really, how do I develop those people? Someone, you know, mentioned this the other day, and I said, it's I got to reproduce myself now.
Right.
Because I can only do so much.
There's only one John.
But so how do we get people to really have that same heart?
Yes.
To say there are people in need, and how do we impact their lives? Because we really are impacting lives every time that we answer the phone, and we answer sometimes a simple question.
Right.
It makes a difference in someone's life. And I mean, that's just really what keeps me going.
Yeah, same here. I love it. I think we have the same heart, and we're passionate about our community. So, is there anything else that you want to share, you want everyone to know about CBI?
No, I mean, I think for us, one of the biggest challenges is talent, is really being able to find the people to do the work. Again, finding people that have the heart for it, but then have the talent and the skill set. And we've been working, you know, locally here with AWC and NAU and a couple of other entities that really are helping to develop that in our community. Really encourage people to look into this field. There's more to it than just, you know, what you see on TV or in the movies or whatever. It really makes a difference in people's lives, and to know that you have that ability to do that. I think there's a lot of people in our community that have the heart, they just don't know how do I go about it.
Right.
And so there's a number of programs, like again, the AWC, NAU have really stepped up. We work closely with their nursing program and their social work program. So they're doing that. But on a bigger picture, there's even greater need.
Yes.
We just can't, honestly, I have open positions all the time that we're hunting for, and we're just trying to recruit, and we're trying to find people. And unfortunately, when we do get people that are trained up, they go somewhere else.
Because they're so good. They're like, I'm marketable now.
I grew up in Yuma. I've been here in Yuma all my life, and I am a big recruiter for our community, because I tell people, why would you want to go anywhere but Yuma?
Yuma's the best place on earth.
I'm like, we're within driving distance of San Diego, LA, Las Vegas. Really, I was looking at this the other day. We're almost like 30% of the U.S. population. We're within driving distance of that.
There you go.
So you have everything here in this amazing community.
It is. It's
so I'm out recruiting all the time for
That's
talent
good to
come
know.
into Yuma.
And it is. It's a position that is going to give you paychecks from the heart
Yes.
that you don't understand until you're in this world. And it was new to me, and I love it. I love every day, everything that we do. And I love working with people like you and your agency. But yeah, Yuma is, I'm born and raised, so I'm a lifer, and I love this community.
And I think this field, you know, it really, there is more than just a paycheck. I got an award a few years ago from the drug court participants. And, you know, to me, that's the most valuable award I've gotten.
That's
because
cool.
these are the individuals who, day one, and some of them have told me, I hated you on day one. The first time I met you, I hated you because, you know, you're really challenging them and you're trying to move them from where they're at. But that down the road, they can come back and say, you made an impact. And here's, you know, and to do that. So that's the only award that's actually up on my wall in my house, because it's the one that means the most to me, because you see the difference that it makes. To run into somebody, you know, at the grocery store, and they come up and they tell you, hey, do you remember me? And I'm like, I'm old, dude. And I'm like, you don't even look like the person several years ago.
Oh, that gets me the
and they
chills.
introduce you to like, oh, I got married and here's my wife and I have kids and I have a job. And
How
to
beautiful.
know that you played a role in that you had the ability to impact someone's life that way is just, that to me is that right there. You don't have to, how much you have to pay me. Don't tell my boss that, but you have to pay me for that, because you really have, that's the real pay that you get for this field.
Yeah, you have to be compassionate, and everyone around our table is. I love that.
Absolutely.
I love that.
And I think that's, again, going back to that Yuma community kind of spirit. This is who we are, and this is what we're about. And when you can show people, here's an opportunity. I mean, it's rare that you don't have volunteers for something when you need something.
Definitely.
It's like you have to fight off some people. Like, hey, we got enough.
I did have to fight off people. But I just hosted an event, grad night, and I couldn't let everybody even volunteer because we just had too many.
No, I think that's the biggest plus of our community. And this coalition, I think that everybody that's involved with it is just, they're in there to like, how do we make a difference? And I think that's the best part of that organization.
Yeah, thank you. Thank you so much. Thank you for being here today. I
Absolutely.
appreciate you. And we're just going to sign off with that. You can find us at YCADC.org. All of our resources, CBI's information, it takes you directly to their website. And we just appreciate you being here, and we will see you next time.